Hey everybody, welcome to Flare Fact Fridays. Hope everybody had a good Thanksgiving. And the topic I chose for this episode is digestive upset and gut inflammation, because I'm gonna bet maybe some people are dealing with this after Thanksgiving, maybe not. But I thought I would share that. So let's get started. So, as always, I'm going to be sharing a flare, what it is, how it shows up, what might trigger or worsen it, and then ways to help that. So, as always, if you would like a flare um, more broken down or for me to dive into it, please let me know. Drop a comment or shoot me a message. So, like I said, this episode is going to be on digestive upset and gut inflammation. Moving forward, I'm just going to call it gut issues because that is a very long title to write on every slide. So, that's just what we're going to call it. So, gut issues, what and why? So, as we all know, lupus, inflammation, I say this every time, but I always like to make sure I say it again. So, lupus can inflame the GI tract, stomach lining, intestines, even your esophagus. So, it may look like food sensitivity, maybe the stomach flu, IBS, so irritable bowel syndrome, if some of you don't know what that means, and a random stomach ache. Often it's tied to a systemic inflammation, so it's not necessarily something you ate, but that's usually when you'll notice it for the most part. So it's an overactive immune system that we have, that's just targeting the GI tract. So the blood vessels will inflame, so vasculitis, which can affect digestion. Medications can also irritate the gut during a flare. So this would be like NSAIDs. So when I say Tylenol, so non-steroidal anti-inflammatory drugs, and corticosteroids, which can irritate the gut, lead to gastrointestinal issues. They can cause peptic ulcers, acid reflux, and other digestive problems. So it's crucial for you to be aware of these and to monitor them and talk to your provider if you notice that it's getting worse or anything like that. And then we also talk about stress. Stress is a big one with lupus. So increased stress, which is increase in cortisol, which is gets to a worsened gut permeability. And so I'll go into what gut permeability is. So gut permeability is the normal intestinal barrier that acts as semi permeable or selective permeability. So regulating the passage of like nutrients and all of the good stuff while keeping out all the bad stuff. But under high conditions of chronic stress, a sustained elevation of cortisol, which is what we were talking about, the integrity of this barrier becomes compromised. And so what happens is with a worsened gut permeability, this increases the permeability of the gut, which allows for the passage of those larger molecules such as toxins, undigested food particles, bacteria from the gut into the bloodstream. So, as these substances leak into your circulatory system, they can trigger an immune response and system inflammation throughout the whole body. So it's just not a good thing. It's extremely painful, and that's usually people mimic as like extreme stomach upset and things like that. So going into a flare also throws off digestion, absorption, and motility. So when I talk about motility, that would mean the movement from food as you put it in your mouth, as it digests all the way down to your colon and is excreted. So if that motility slows down, people feel full, they feel bloated, all of that kind of stuff. So how does this present? Common symptoms. You could probably name these. I probably don't even have to tell you. Bloating, nausea, cramping, diarrhea, or constipation, depending. So if the food's moving too quickly, it could be diarrhea. If it's moving too slowly, it's going to be constipation. Sudden appetite changes, burning sensation or reflux, and then feeling full just after a few bites. Also having that GI pain during a flare. And then there's also this thing referred to as the lupus belly. I've heard this a couple times, and it makes sense. I if I have experienced it, I don't think it's been to the extent of emergency room worthy, or it's been lasting more than a couple days. But the lupus belly is painful swelling, tight or distended abdomen, so it's kind of like that drum belly. Exhaustion after eating, and it feels like inflammation, not overeating. Like it's a different sensation. And when is this serious, right? So we all get bloated. We all have, a little bit of GI issues here and there, right? And so The fun thing though, when you have lupus, is you get to play the game. Is this lupus? Is it the stomach flu? Is it food poisoning? Is it an allergy? We get to play the game. And unfortunately, nobody wins here. But if you can kind of figure out if there is a trigger for you, that would be super helpful. So, but when to seek emergency care would be gastritis, lupus enteritis, or vasculitis. So this would be extreme, extreme abdominal pain, persistent vomiting, blood in your stool, sudden weight loss, fever, pain that wakes you up at night. Okay, so please, please, please don't think it's like, oh, it's just going to pass. If it's any of those things I just listed, please seek immediate medical care if you are experiencing any of that. I have a little picture for reference so people can kind of see like what I'm talking about there. You've got your esophagus at the very top, which goes into your stomach. And so you can see where it's like inflamed. You can see where there'd be an ulcer sitting and anything like that. So you can imagine when that ulcer is there, it's literally an open sore in your gut. So like feeling that it would just extreme uncomfortable, right? And so that would be the like burning feeling and all of that kind of stuff. So with prolonged symptoms of these severity can lead to a lot more complications. So what can trigger this, right? So stress, of course, we know stress triggers everything with lupus, but stress increases your gut sensitivity. We talked about the high cortisol, which leads to the gut, worsened permeability, but also can lead to slow digestion and inflammation. And then emotional flares lead to physical flares. You like to think that your brain and body, like your, mind, body, all of that is disconnected, but we are a whole person. And so emotional flares can lead to physical flares. A lot of people will say, I'm so upset, I'm sick to my stomach. Like that's a real thing. So definitely like keep that in mind when you're having some emotional things. Make sure you're taking care of yourself, make sure you're staying hydrated. I'm always going to push water. It's such a big thing that so many people think doesn't do a lot, but it really helps. And then other triggers can be medications. So, like I had said earlier, NSAIDs, so those non-steroidal anti-inflammatories. Tylenol is usually the first one that comes to mind. Steroids, unfortunately, which we use to treat lupus, as well as immunosuppressants, these can all irritate the stomach. So, even helpful meds can disrupt your gut flora, and so that's what you just want to make sure you're keeping an eye on, as well as combination therapy. So, if you're taking NSAIDs, if you're taking steroids, if you're on immunosuppressants, any of that, you're just increasing your risk potentially of having gut problems, which again, the medications that we're trying to help us could potentially be causing some other issues. So other triggers could be food. So spicy foods, highly processed foods, fast food, high sugar intake. Dairy for more and more people is seeming to be a prominent cause. And then also gluten. I feel like gluten is maybe a 50-50 shot. Some people cut it out just because they seem to feel better. It might not necessarily affect any of the gut stuff, but overall, people start to feel better. But I would say about half the people, gluten is definitely a trigger for gut issues. And then, of course, you've got infections and illness. So, viral infections can spark a lupus flare, especially a GI flare. Lowering your immunity equals more reactivity in the gut, and it can make you feel worse even after that infection clears. So, your stomach doesn't always recover as fast as the rest of the body. It's still very sensitive. So, you want to be able to make sure you've got your antibiotics or whatever you're taking and all that kind of stuff. Make sure you're eating good foods, like we say on the left-hand side there, avoiding the spicy foods, avoiding the processed foods, limiting sugar and all of that. So management of this, you've got anti-inflammatory foods that are really good and are really yummy. So you've got berries, anything, greens, turmeric, and ginger. And then you've got lean proteins, bone broth, easily digestible foods during a flare, right? You want to eat smaller, more frequent meals, things that your body is not going to have to work hard to try to digest. Peppermint tea is super helpful, as well as ginger tea. Always have a heating pad near you, by you, around you. If you could have one in every vehicle and every room in your house, it would be absolutely awesome, right? Making sure we're eating slow. So chewing slowly, chewing thoroughly, this actually also helps to limit overeating as well, if that's something like you're concerned with. So the recommendation is to chew a piece of food like anywhere from 20 to 30 times before you actually swallow it. And this slows down, your eating and all of that. And so actually makes you feel fuller without overeating. And so that's always good. It kind of lets you know when you're getting full. So And then keeping a food journal or like a symptom tracker is super helpful, especially starting out. I would say that I used to write everything down. I still write some things down because I still do have some gut issues that I myself am trying to work through. But I definitely keep a food journal and a symptom tracker when things are kind of going funky out of nowhere, to try to figure out, what's going on, because I don't want to feel like that. Nobody wants to feel like that. So those are some good tips and tricks for that. More management. So taking like acid reducers. So like you think of Tums, Prilosec, omeprazole, like, any of those kind of things. Anti-nausea meds, any gut protective medications. So when I say gut protective medications, I'm talking about medications that are actually designed to safeguard the mucosal lining like of your stomach and your intestines from damage that can be caused by those acidic like gastric juices. So these can be anything such as sucralfate, which kind of like coats the stomach. And it also helps with forming like a protective layer to prevent any other damages. And then there's the difference between gastroprotective and so there's the gastroprotective agents, which help protect the stomach lining from ulcers and irritations, particularly, excuse me, from those damaged with NSAID-induced ulcers or gut irritation. And then you have the gastrointestinal agents. This category includes various medications that can regulate your stomach acid production, your bowel movements, gut motility, ensuring the smooth functioning of the digestive system. So, like I said, from food in the mouth till it's out, you want to make sure that that system is working correctly. So, these medications are crucial in managing conditions like peptic ulcers, irritable bowel syndrome. What they do is they enhance the body's mucosal defenses to promote healing. So, they're working to heal, and things like that. So, those are super important as well. Management, again, steroids or immunosuppressants. I know they can cause gut issues, but in a flare, in crunch time, in an absolute painful, whatever you're dealing with, please use your steroids if you have them or ask your provider about them. Make sure you're having those open conversations with your provider. By no means am I telling you to manage this without talking to them, but just these are some good things to like keep in the back of your mind. Maybe have some stuff in the medicine cabinet, readily available. Other kinds of management would be stress reduction techniques, breathing exercises, gentle movement. You can do manual peristalsis, so clockwise on your belly, helps to stimulate that movement as well as adequate hydration. And when you're resting, make sure like you're pacing. I know that sounds like you're not really resting, but like rest and then move around, right? Because like movement is going to move what's in your body as well, right? So not overdoing it or anything like that, but just taking note to have your, I call it my daily purposeful movements. And just a little reminder before we get off of here, the things we're not going to ignore. I know I say a lot of like ways to manage things, but this is something that can turn really bad really fast, especially if you're leaking bacteria and stuff into your system. If it's getting out of your stomach, that can cause systemic problems, which we like to call sepsis in the medical world. So you just definitely really want to be careful. So, a couple things before I'm done with this. So, what not to ignore: the sudden severe pain, fever accompanied with stomach symptoms, vomiting that doesn't stop, blood in your stool, and pain after eating every meal. So please don't ignore those things, okay, guys? Use the helpful tips and tricks. Be aware of your triggers. Be aware of, what in your body is talking to you, but please, please, please do not ignore these symptoms. All right, guys, that is it. That is all I have for you. So I hope you had a wonderful Thanksgiving, a wonderful family time. Hopefully, none of you are suffering from any gut issues or overeating or anything like that. So I hope you have an absolutely wonderful weekend. Thank you so much for tuning in. And as always, let me know if you want to hear a new flare next week. Obviously, I'm going to keep going with what I want to do, but I would absolutely love to have some inputs from you guys. So, anyways, talk soon.